Good evening and a warm welcome to Beyond the Lockdown. Tonight, for the very first time, Ghana is embarking on a mass registration for national ID cards and voter ID cards amidst a... Welcome back. It's Beyond the Lockdown here on the JoyNews channel. Thanks for staying with us. And of course, we're on a dozen affiliates across the country, also live on Facebook, on YouTube, DSTV channel 421 and GoTV channel 144. Tonight, we're talking about a mass exercise amidst a pandemic. And joining me via Zoom is the Director of Electoral Services, Electoral Commission, Dr. Srebo Kweku. We also have Mr. Michael Buedu, who is the Director of Training for the Electoral Commission. And then in the studio tonight, we have the Assistant Commissioner of Immigration, Mr. Francis Palmdetti. He's Head of Corporate Affairs of the National Identification Authority. Welcome.
Thank you very much.
How are you doing? How was your weekend?
Very well.
We have Dr. Srebo Kweku also joining us via Zoom. You're welcome, Dr. Srebo. Okay, so we'll try to rectify that and then also get Mr. Buedu joining us. Okay. Good evening and thank you so much for your time, Dr. Srebo. I hope you're doing well.
I hope you're also doing well.
By His grace, I'm doing very well, and thanks for asking. So I'll start with you, Mr. Palmdetti. We'll also try to get a stable connection to Dr. Srebo and also Mr. Michael Buedu. We've started an exercise across the country. We're trying to distribute over 5 million cards, if I'm correct. 3 million.
3.8 million cards.
3.8 million cards. How has it been so far?
So far, it's been good. We started on Wednesday, and Greater Accra started on time. On Wednesday, we had to drop some of the items by, we used the flight to drop the items in Kumasi, Tamale and Wa, and they were distributed to various districts and regional capitals, etc. And so I'll say the first day, it didn't start very early in the various regions, but in Greater Accra started on time, and subsequently it's been good. So
this is just an issuance. Are we looking to start another batch of registration, for instance? What really is the protocol? So
this is a card collection exercise. When we started the mass registration exercise across the country, every region that we moved into, as we left the regions, we noticed that some applicants didn't pick their cards, some cards are not ready. So we had quite a lot of cards after we had gone through all the way to Eastern region. Yeah. We noticed we had about 3,000 cards we had to distribute. That was in our original plan before the COVID stopped us. Our plan was to finish in April, but we had moved so fast because we had additional equipment. So we were going to finish in March, distribute cards in April, and also do a mop-up in April in areas where we felt we didn't register a lot of people. Yeah. So that was the plan until COVID stopped us. So what we're doing now is basically carry on with that plan, make sure we distribute those 3.8 million cards before we start the mop-up exercise, which we hope will follow this particular card collection exercise, hopefully from the middle of this month. Okay.
Well, for you, Dr. Srebo, you have an impending exercise coming up. It's faced a lot of criticism. It's still a subject of controversy now as we speak. But the EC remains resolute in this plan to carry out its mandate. We're still in court also, waiting for a court order. How has this week been in terms of preparations? Tell us a bit about where we are in terms of preparations for the compilation of the new voters register on 30th of June.
Good evening, MFI, once again, and good evening to our listeners. We have finished with the TOT. The TOT just means that we are training the supervisors, the key trainers, and others who will go and train the people on the ground. We have finished with that, and we have started the training, the grassroots training, where we are training the actual people who go to the field and get the data for us. So that's what we are doing now.
Well, safety protocols is the concern for many when it comes to the NIA exercise, and of course you, Dr. Srebo, but these are in some of the questions that we received. So quickly, before we go into the first batch of questions for both the NIA and the EC, one nagging question that I would want to clear out of the way is the issue of not using the birth certificates and the existing voter ID card. So somewhere in January, for instance, looking at a slide that you presented, slide 27, for instance, in your presentation, You mentioned that we're able to use the existing ID card. You told that subcommittee and all. That was, some presentation that you made at the time. But now we had a change of plan. And what actually changed along the line such that we are unable to use the existing ID card for the upcoming exercise? What actually changed?
That is the issue at the court. So we'll do this, but let's wait for the court to give the judgment, then we can discuss. Okay. For now, the use of the ID card is the issue that will be determined by the Supreme Court. Whatever the Supreme Court will decide, we are law-abiding institution, will go by that. But for now, it is at the Supreme Court, so let's leave it there, please. Okay,
but the issue also about insistence that the Ghana card and, of course, the passport is what we are going to be using. You've talked about that part being in the Supreme Court, but I would want to find out, how can we say on authority then that only eligible Ghanaians hold Ghana card and passport? How sure are we that that is what we are going to get? Because if we say that the birth certificate and the existing voter ID card is contaminated, so to speak, hence that's why we are using Ghana card and then the passport for the upcoming exercise. How sure are we that if we use the Ghana card and the passport, we are getting only eligible voters who are holding it?
I don't know who said the birth certificate is contaminated. It has never been used as part of a requirement. And the reason is that it doesn't have pictures. All the cards that we use, they have picture identity. So that you can look at the picture and identify that this is MF4, this is cerebral. So any form of identification that doesn't have picture have never been used before. So it is the Ghana card, the passport, the voter ID card, the driver's license, plus the guarantee system that we used to get. But like I said, now it is the issue that is to be determined by the Supreme Court. And whatever the Supreme Court will decide, the Commission is the law-abiding institution, will go by it. So please, for that, let's leave it there and wait for the judgment of the Supreme Court.
That's not too far away. June 23, we'll be looking at it. But for you, the Ghana card, I'm sure these are the issues, like I said, will be coming up in the questions. But this show is not for me to be asking all the questions. If you leave me, I'm going to ask all the questions. But let's get into the first batch of questions, as we also welcome Mr. Michael Boyd, who is the Director of Training at the Electoral Commission. If you're ready, let's get into the first batch of questions. So this one says it has a video attached to it, video evidence of one of the exercises in one of the areas. And it says, NIA, is this the social distancing you promised? And then this one from Facebook says, MFA asked the EC if there will be vote transfer. And if there will be, is it going to be during the registration or after the registration? Because most of the national service personnel are not in their respective districts and would like to go back home coming December 7th to vote for their preferred candidates. Also to the NIA, those of Ghanaians who don't have the ID card, are there any plans for them to get it before the compilation of the new register starts? Ajara is asking that. And then this one says, will the over 8,000 active COVID-19 patients be allowed to register? If no, why? If yes, are they going to join the queue too? And Christian asks the second question, how is EC going to capture those who can't return to the country because of the border closure? Any Nojid Oscar says, what accounts for issuing more than a card to one individual? Others also allege that currently registrants do not go through biometric processes before their card is given to them, but only sign thumbprint. Why? So another one from Manuel Rankin says, did the EC know we are in rainy season? Did the EC know we are in coronavirus pandemic era? Is the EC thinking about the lives of Ghanaians, or compiling the new voters register is more important than our lives? Manuel Ranking sends that one. So a number of questions coming in. I'll get you that shortly. But we'll start with the video that we got. We didn't get the specific area that is coming from.
I'm also not sure which video it is, whether it is during the card collection exercise or during the registration exercise. It's really not clear.
It says during the card exercise, because we can see some people wearing masks, but others are not. And it's asking if this is during the collection, and asking whether this is the
unfortunately, we cannot actually see from the video where the collection is taking place. We are just seeing the precincts of a certain building. We are not sure where exactly it is taking place.
But can you say that we are observing social distancing protocols at the collection points?
We've trained our district registration officers who have trained the supervising registration officers on how to coordinate persons who come for cards at the centers. We've given them strict instructions to ensure that persons who come there are observing social distancing. And they should wear a mask before they are allowed into the registrations area. And they should also make sure they've sanitized their hands. There's what do you call it, running water there for people to wash their hands. We've been trained by the Ghana Health Service, and they've told us that even where you don't have a running water, you need sanitizer to be in place of that so that they can sanitize their hands before they go for the cards. So those are instructions we're giving out. We've issued PPEs to our staff, rubbing alcohol, face masks, hand sanitizers, temperature guns, and shields to conduct this exercise. So I believe this would have been more helpful if we were told the exact center, the exact location, then we could investigate it. But the instructions around and from the observations we've had, our officials are actually complying with it. There may be areas where maybe these things may occur, but if we know where they're happening, it will be useful that the public informs us that we put in remedial measures.
Okay. Well, so there's another question for you, Dr. Sribo. A number of questions that, if we're not careful, we may lose track of. But we'll go to you. Some questions also came for you, Dr. Sribo. For instance, whether EC is aware that we are in a rainy season, for instance, or the cat is more paramount for you than the lives of Ghanaians amidst the spiraling cases that we have.
Okay. Thank you very much. With respect to the rainy season, that is why it is not a one-day activity. We are going to spend at least 6 days at a polling station. In addition to that, after we are finished, if it comes out clear that because of rains or something else, we couldn't complete the registration at a point, when we are finished with the main registration all over the various polling stations, we have days that we are going to set aside for mopping up. So the mop up will cover areas that could not complete the registration due to exigencies like the rains and the rest. Now, with respect to the question of whether the lives of Ghanaians are not important to us than this, we are in the COVID period and the election too should be held. And if you want to do the election, then you have to do the preparation towards the election. Election is not an activity, it's a process. So we need to do all the processes leading to the election. And that's why we are going by the various safety protocols. We have had a lot of encounters with the national coordinating team of the COVID team, and they have given us a lot of pieces of advice, and we are implementing them. So even at the training that we are doing, if we go to our centers, you realize that we are using all the PPE that are required to do the training. So we are hoping that on the field we apply all the safety protocols.
Well, so there were a number of questions. I'm sure we'll just bring back a few of them again. But there was one also specifically for you asking what plans you have for COVID patients, for instance, when the exercise start. And then the issue also about vote transfer. If there will be vote transfer, how is it going to be done? And then what accounts for issuing more than a card to one individual? That is for the NIA. We'll come to it. So you've answered this one. So I'll ask you about the vote transfer and then the plans that you have for COVID patients.
You see, by the law and the regulations, people are supposed to register at their various polling stations or where they will vote. So as you said, it's not only COVID people. There will be people who will be on admission at the hospitals and the rest. These are the people who may not be able to go to the polling station. And I don't, Commission, to the best of my knowledge, have not taken a decision on that because you're supposed to register at your polling station. So when we get there, maybe on the advice of the coordinating team and the rest, we'll see what to do. But really, everybody is supposed to register at where he or she will vote. With respect to the transfers, this is my layman's understanding. The law is that after you have registered, you should have relocated for not less than 12 months. So if you have to relocate for not less than 12 months, then it means that as you are going to do registration now, you should be at where you have relocated. So you register at where you are staying. And if you register now, you will not have the 12 months to qualify for movement to do transfers. So my layman view is that this year there will be no, you can't have transfer because nobody will qualify.
Well, so that's responses to some, but I would want to quickly find out. So what you're saying is at the time of, registration, if we're COVID patients, for instance, we have about 6,000 active cases for now. So if we have patients at the time, we don't have plans for them just yet. We don't know what will happen during the exercise when you have been infected and you are in one of the centers.
Yeah, right, exactly so. What I said was that you are supposed to register at your polling station. So if maybe the commission decides that they are going to take a step outside the polling stations, then it will be something else. But for now, I'm not aware the commission has taken a decision to go to the hospitals or where the people have been quarantined or isolated to do the registration. The same thing applies to people who will be on admission. We are doing the registration at the polling stations, but not at the hospitals and the rest. So maybe the commission may take a decision, which I cannot say for now.
Okay. Well, so Mr. Pamdeti, yes, for you as well.
Yes. Now he asked about whether there will be an opportunity for those who are unable to register to register. Yes.
Before the exercise starts on 30th of June.
We are now issuing the cards. We intend finishing that this week, hopefully on the 18th, and then immediately go into the mop-up exercise. So during the mop-up phase, those who are unable to register during the mass registration will have that opportunity to register. So there's always a chance. Now, even after the mop-up period, we'll open offices in our various districts where they can walk in and go and register for the Ghana card. Now, let us also indicate that we have our timetable and we are moving the timetable. It just so happens that it coincides with EC's activities. But the Ghana card is not the only route to getting yourself registered and getting onto the voter register. There's a passport, there's a Ghana card, and there's that option where you can vouch for somebody. So we have right now, as we speak, 11 million people on our register. Hopefully by the time we are done with this exercise, all 11 million people should have their cards to be able to either use that to register or to help other people to go through the process. But I just want to say that we have our plan, we are following our plan, and we are not rushing to meet EC's target. EC is a separate institution, we are also a separate institution. Our program is to run throughout the entire year, ensure that Ghanaians get the Ghana card. But it's not just for elections. There are 17 other services that you require the card to obtain. So in application for a passport, you need a Ghana card. Opening the bank account, paying taxes, registering for a SIM card, registering as a voter, pension transactions, land transactions, NHI registration, SNIT registration. All these things require the card. So our motivation and our driving force is so much for people to get the card and use these cards for these services.
But now that is one of the requirements for the upcoming exercise on 30th of June. That's how come they are wondering. So if you don't have it, will you be able to get it before the 30th of June to be able to participate in the upcoming registration exercise?
Come 30th of June, not every eligible Ghanaian will have the voter with a Ghana card, because by the law, we are told to do a mass registration and a continuous registration. The law itself contemplates that not everybody will get a card during the mass registration phase. That is why the law makes provision for us to set up offices for those who are unable to get it, go to the offices to get themselves registered. So it's a process, and it's not an event where you are done and then you wash your hands off, you're done. No.
So you have room for that to happen?
There's room for that to happen.
So as we speak tomorrow, if you come to your office, we are able to get it done?
No, we don't register at our office, but we have registration centers across the country. Those centers will be activated for registration when we start the mop-up.
When will that be done?
That will be done, we scheduled 18th of this month, a starting mop-up. But we'll start in regions. We'll take a chunk of maybe 2 or 3 regions, tackle them, and then move to the next batch of regions, and that's how we'll go about it. But for us, it's an all year through program that we are doing. By the time of elections, those who have it, I'm sure will be able to go ahead and register. I'm not sure every eligible Ghanaian would have had the card by the time.
Okay, but Dr. Sribo, also just before then, there's one related question that also came from Dr. Sribo, the issue about those who are locked out because of the border closure. For instance, we don't know what the president will say tonight in that address, whether we're going to open the borders just yet, but we wait for that to happen. But do we have plans for those who are locked out because of the border closure in terms of the registration?
Like I said, we don't know when the borders will be opened, but this exercise is going to continue to the last person who will make himself available to be registered, we are going to use not less than 38 days. So if the people will come to Ghana within the 38 days, then they'll be covered. Other than that, the commission will have to take a decision.
So as it stands now, we don't know what will happen if the borders are not open and the 38 days expires, for instance. So there's no plan for them. If you are locked out of the country as we speak, you don't know what will happen to them during the registration exercise. You know,
the borders are closed, so they cannot come. We cannot also go out. We don't have control over that. But whoever is in the country will cover the person.
Okay.
But we cannot go out because the border is closed.
Well, so that's the response to that question that came about those who are locked out outside the border. There was also that for you as well.
Yes, there was issue about multiple cards being printed. Yes, we've had occasion where a few applicants have had multiple cards. It's not because they had registered twice or double registration. It's just that we had a system update which affected those cards. Now, what it means is that the multiple cards that are printed, only one of the cards will be activated. All the other cards are pushed into what we call a watch list, meaning that those cards cannot be used. So persons who had multiple cards at the centers will be invited, and they would let them have the activated card, and then the others will be kept by the authority. But it's not a case of double registration. We know the number of cards in that category, and we are dealing with that. Now, the issue about verification, manual verification. You know, when it comes to identity issues, there are various levels of verification. We have manual verification, which is the ocular verification, using your eyes to examine a document thoroughly. And then we have the match on card verification, where a card is slotted in, you're asked to put a finger on the card for us to tell, because the gadget can read the card or the chip on the card to tell whether indeed you are the person. Questions will be asked also. Then we have the one-to-many verification, which is an online verification to the central site. Now, this particular card collection exercise, we had to consider a lot of factors. One being COVID. How do we give out loads of cards in an environment where there's COVID? What can we do? So we said, okay, in order to give out this card speedily, we have to use an album. And in that album, you have dummy cards with pictures of applicants and their details on the card with a portion to sign or to thumbprint. The idea is that when you come, the official will identify you. If your card is in the lot, we'll take your card. Some people have signed, some people have thumbprinted. Those will be checked before the card is given to you.
Well, not to cut you, Mr. Palmdetti, but we have to go to the Jubilee House now for update number 11 from the President, where we shall return with more on that. The President will be giving us the address, update 11. It was unexpected, but that is going to happen. I'm sure many of you were thinking that it's going to happen in July, but yes, our cases have gone up, nearing 11,500, and the President is supposed to address us tonight on this. We have to welcome our listeners also on Joy 99.7 FM and all our platforms. We'll be going live to the Jubilee House now, if we're ready.
Fellow Ghanaians, good evening. Exactly 2 weeks ago, I came again into your homes to outline a roadmap for easing the restrictions put in place to help contain the spread of the coronavirus pandemic in our country. I indicated that it would be a phased approach involving a selected list of public gatherings based on their risk profile, socioeconomic impact, and most importantly, our capacity to enforce and to respond in the event of a flare-up in our number of infections. Since then, we have had some of our religious institutions opening their doors to worshippers, while respecting the limits of numbers and maintaining the strict protocols announced. Others have decided to remain closed until further notice. Private burials are taking place. Marketplaces, public transport, including domestic air transport, restaurants, hotels, individual and non-contact sports, and our constitutional and statutory bodies are conducting their activities in accordance with social distancing and the relevant hygiene protocols. From tomorrow, Monday, 15th June, the last batch of institutions in this phased approach, our educational institutions, will begin to reopen, with final year students in our tertiary colleges and universities returning to school to prepare for and take their exit examinations. As has been stated, final year senior high school SHS3 students, together with SHS2 Go Track students, will resume on 22nd June, and final year junior high school JHS3 students the week after on 29th June. The decision to include our schools in phase 1 of the easing of restrictions was taken advisedly. Some argue that we're putting the lives of our students, teachers, and non-teaching staff in danger by this reopening, citing the examples of other countries who have done so and recorded spikes in their infection case counts. I've stated on several occasions that there is no one-size-fits-all approach to the resolution of this pandemic. We have our own unique situation in the country, and we have always taken that into account in dealing with this disease, much as we are prepared to learn from the examples of others. Fellow Ghanaians, over the last 3 months, every aspect of our national life has been affected by this virus. We've had to take deliberate steps to ensure that our society, in the face of the pandemic, is able to function and continues to strive to deliver the results of progress, prosperity, and development for which we all yearn. Saving lives, jobs, and livelihoods, revitalizing our economy, and safeguarding the future of our country have been at the heart of this endeavor. We cannot say that because of the pandemic, we're no longer interested in issues of social justice, such as education and health. Education, indeed, is the key to the future of our country. The quality of education that our educational institutions produce ultimately will determine the success or otherwise of our nation. We therefore have to find a way of guaranteeing the prospects of the generation of young people who are the objects of education today and who represent our future. We have to do everything within our power to protect their potential and thereby help preserve our future. We cannot afford to let the pandemic undermine our chances for survival and progress. We have to confront our present and future with confidence, knowing fully well that we must remain at all times vigilant and careful. So from tomorrow, operating with half the class size, final year students will begin a 6-week period of learning to finish their respective programs. Subsequently, for a period of 4 weeks, they will sit for their exit examinations. It must be put on record that some final year students will not be returning to school, as some of them, through virtual means, have already sat their exit examinations. Prior to their return to school, government, through the Ministry of Education and the Ghana Education Service, has ensured that all tertiary institutions, public and private, have been disinfected. Universities, with their own hospitals and clinics, have been equipped with the necessary personal protective equipment and have isolation centers to deal with any positive cases. All other institutions, without their own clinics and hospitals, have been mapped to health facilities. There will be no mass gatherings and no sporting activities. Religious activities under the new protocols will be permitted. Social distancing and the wearing of face masks must become the norm on campus. To aid in this effort, a total of 600,000 face masks has been distributed to the tertiary institutions. This is to enable every student, teaching and non-teaching staff, to have 3 reusable face masks. In addition to this, 1,700 Veronica buckets, 200,000 liters of hand sanitizers, 3,400 liters of liquid soap, and 900 thermometer guns have been distributed, with the transportation and delivery of these items being overseen by the special to total tests conducted stands at 4.7%. In our hospitals and isolation centers, we currently have 13 persons severely ill, 6 persons critically ill, with 3 persons on ventilators. Mercifully for us, by the grace of God, the number of COVID-19 related deaths, sad though each death is, continues to remain very low, one of the lowest in Africa and the world. With 54 deaths currently reported by the Ghana Health Service thus far in Ghana, the ratio of deaths to positive cases stands at 0.4%, compared to the global average of 5.5% and the African average of 2.6%. The number of severe and critically ill also continues to be low. I am relating all these figures not to engender any false feel-good factor, but as statements of fact that must provide the context for us when we examine our figures. If indeed we are to be guided by the data, then we must look at the data in all its ramifications, not just one particular aspect of them. That is the proper way to do justice to the data. I'm thus in no way suggesting that we should let our guard down and throw out of the window the efforts we have made in bringing us this far, where we have become a reference point for many in the handling of this pandemic. On the contrary, as we begin to ease the restrictions, we must be even more disciplined in our adherence to the personal hygiene and social distancing measures we have become accustomed to. We must keep fit, and we must continue to eat our local foods to boost our immune systems. This is how we can prevent our healthcare services and our heroic healthcare workers from being overwhelmed due to an increase in demand for hospital care. Nevertheless, I implore you to pay attention to your health. When you begin to experience symptoms such as fever, persistent cough, bodily pains, loss of taste and smell, and difficulty in breathing, seek immediate medical attention at the nearest health facilities. I remain concerned about the stigma associated with this disease. Stories of persons who have recovered from this disease and being shunned by their own relatives and communities are a source of considerable worry to me because they undermine our efforts to fight it. There is nothing shameful about testing positive. We do not have to lose our sense of community because of this pandemic. Government, through the Ghana Health Service, continues to monitor on a daily basis the spread of the virus and has benchmarks of health outcomes which define the mitigation measures that must be pursued to curb the spread of the disease and enable us to reassess the easing of restrictions. It is important for me to remind residents of the Greater Accra and Ashanti regions, where the great majority of cases have been recorded, and in the western and central regions, where we're seeing an increase in infection cases, to continue to adhere strictly to the social distancing and enhanced hygiene protocols announced. With the doctors and scientists telling us that the virus is transmitted from human contact through talking, singing, coughing, and sneezing, which results in sending droplets of the virus from one person to another. Residents of these 4 regions, and indeed all Ghanaians, must remember that the wearing of masks is now mandatory. Leaving our homes without a face mask or face covering on is an offense. The police have been instructed to enforce this directive, which is the subject of an executive instrument. Let me repeat, our survival is in our own hands. If we are lax and inattentive, we will continue to have serious challenges with the virus. If we are mindful and self-disciplined, we have it in us to defeat this pandemic and help return our lives to normalcy. I appeal to each and every one of you for your help in this regard. That is the surest way to realizing our collective vision of building a new Ghanaian civilization where the rule of law is not a slogan, but a directive principle of state development, where we deliver social and economic transformation that has a meaningful impact on the lives of all of our people, where a strong and vibrant economy creates jobs for the masses of our young people, and in the process, creates a society of opportunities and aspirations for all, where we are no longer pawns nor victims of the world order, and where the vision of our founding fathers of a free, progressive, and prosperous Ghana is attained. Let us together rise to the occasion and fulfill our common destiny. We can do it. Enuanom, efiri echinako, yema sukufo a woni ba bewie no, besan ko school, akotre won sohwe a etoato. University for bekochina. SHS 3 ni SHS 2 go track for is beko ochina na awotwe. JS3 for also beko na awotwe a ediso. Awo for teaching. Mi mamu nyina tiase se ihihye a biara e wose yeye di boy ma ho ban aban aye misramo eni yama enkoso indi ihihye a ediye be boy ho ban no eso na onyankopon adaroma yentumi eyi saa yare influence anyame me kejewo obi fe na abagbe school na Bayer school na Magma ame nagbe wolue university B Bayer wo ni SHS 3 ke SHS 2 go track B Bayer was Ochi JHS 3B Bayer school Ochi enyomni mismo ninye fe nye no yake wotogbeji ani fe ojugba ni waka wo ba ni ibaha wo bi fe aya school isani ko behi min panya fai waka wo bi fe abomode ni bi fe minke ye yano ni modromo waka neke hilane aje wote. In conclusion, fellow Ghanaians, permit me to pay brief tribute to the memory of an old and valiant colleague in the struggle of the New Patriotic Party and in the work of the Akufo-Addo government, the mayor of Sekondi Takoradi Metropolis, the chief executive of the Sekondi Takoradi Metropolitan Assembly, Honorable K.K. Sam, Eja Sam to me and many, whose efforts in enforcing social distancing protocols of the Sekondi and Takoradi markets were recently highly commended by me, and who sadly passed away on Friday as a result of a COVID-19 related death. May his soul rest in perfect peace in the bosom of the Almighty until the last day of the resurrection, when we shall all meet again. Let us also wish our hard-working Minister for Health, Honorable Kwaku Agyeman-Manu, MP for Doma Central, a speedy recovery from the virus, which he contracted in the line of duty and is in a stable condition. May God bless us all in our homeland, Ghana, and make her great and strong. I thank you for your attention.
From the Jubilee House with updates number 11 from President Nana Addo Dankwa Akufo-Addo. So I'll start from the bottom, quick recap of the issues that we've raised. And we're hoping that we'll be joined on the phone also by the Information Minister, Kojo Ponkroma, for some clarity on some of the areas. I've seen some of your questions coming in on some of the issues raised by the President. But of course, we'll start with the speedy recovery of the Health Minister, Kwaku Agyeman-Manu. We reported this weekend that he is at the UGMC after contracting COVID-19. But as it stands now, our case count is now 11,964. That's where we stand now as a country. But fully recovered cases, 4,258. The active cases as a country is 7,652. So our positivity rate, we're told, is 4.7%. We have 13 persons severely ill, 6 critically ill, and 3 on ventilators. Our death toll is 54, and we are told is the lowest in Africa compared to the ratio of death, which is 0.4. That's our ratio of death, 0.4% as a country. The world is 5.5%, 2.6 in Africa. We've done 331 tests as a country. That's test that we've conducted, one of the highest in Africa, qualitatively different and effective, we're told. So the focus on the rise, he's also been talking about it. That's at June 13, midnight. I've just told you it's 11,964, inching close to the 12,000 mark as a country. But our active cases is 7,652. And we've been told that, of course, from the last announcement, the first phase is being rolled out of the easing of the restrictions, and tertiary colleges and universities are starting tomorrow. Then the week after, we'll have students from the final year students of the senior high schools, and then then we have the JSS also continuing to write their basic certificate examination. So safety protocols will be observed, and that we cannot let the pandemic undermine our progress as a country. So we must remain vigilant. Schools will be open for final year students. We've been told that the vice chancellors have pledged their cooperation, their full support to the exercise. So disinfection has been done. Protocols will be observed. Masks have been distributed. 3 reusable face masks for each student. Veronica buckets, sanitizers will also be distributed. Guns, thermometer guns will have soap also distributed, as well as sanitizers. And this is being the process is being overseen by Senior Minister Yao Osafomafo. So that's where we are. So there's no one-size-fits-all approach. Those who've been talking about other countries and after reopening school recording spikes, we've been told by the president that one size does not fit all in terms of dealing with COVID-19. So this is our system, but of course, reassessment of the restrictions is still underway. So Accra and Kumasi residents, where the cases are highest, must adhere to protocols strictly. And we've also been paying tribute to Honorable KK Sam, the mayor for 2nd D. So that's a summary of what we just witnessed from the Jubilee House, President Akufo-Addo's update number 11. So that's where we stand, 11,964. Still with me in the studios on Beyond the Lockdown is Mr. Palmdetti. He was on the floor before then. We also have via Zoom Dr. Srebo Kweku. Dr. Srebo Kweku, who is also the Director of Electoral Services for the Electoral Commission, and then also Mr. Michael Buedu. I don't know if we've rectified his Zoom, and he's the Director of Training at the Electoral Commission. But whilst we try to get the Information Minister, Kojo Ponkrumah, for some clarity on the reopening tomorrow and where we are in terms of the distribution and all, we've been told that there will be no mass testing for lecturers, but some of you have been asking. But Mr. Palmdetti, you've been verifying the video that you saw earlier, and you've been told that...
my officials in Bekwai have just confirmed that that particular video is a video of a location which is the Ghana Revenue Authority office in Bekwai.
Okay.
And those out there are actually going for their tax identification numbers, and that is the queue for that particular process. It's not a card collection center, and it is not an NIA related video. I just wanted to clarify that. I was actually...
That will also verify.
Sure.
I'm sure the person that sent it would.
I was also explaining the issue about manual verification. It's not novel. It's part of verification processes. So you have the ocular verification, like I said, which you have to inspect the card and also do a verification of the information you have against the person standing before you. We also have the match on card verification, and we have the online verification. What we are doing now is to, one, enable us serve as many people as possible.
Yeah.
We also want a situation, we didn't want a situation where we will start mop up, and these 3.9 million people, because they want their cards, would also flock to the mop-up centers and overcrowd the place because of COVID. We didn't want that to happen. Now, there were times when, during the registration, you had our original verification plan. You would have to place your fingers back on the scanner. It uses a network. So there were times when that network will fail. And so you can't get the card, even though the card is ready. In order to circumvent that, and also ensure that the integrity of the system is intact, this card album was introduced. Now, when you look at the card album, there's a what we call a QR code. It's a square on the dummy card. After applicants have signed as having collected a card, the album is sent back to head office. That QR code is scanned. The person's PIN number is in that QR code. Then we connect it to the what we call the system that records that one has
So the assurance you're giving is that there is no way there will be multiple...
No, absolutely not.
Okay.
And you see, even if you have, some people are suggesting that somebody can go for somebody's card. It's something that cannot happen. But even if it happens, you cannot use the card. It's a smart card that can be read. And obviously your biometrics will not match the biometrics of the true owner of the card.
Okay,
so
let's go quickly through the next part of questions. I'm sure it will give you an opportunity to explain more because we have a number of questions and we have so little time. We need to go through them. So let's go through the next part of questions quickly.
My question goes to Mr. Srebo. Now I want to know, now we are aware and they are very resolute, they want to do the new register come 30th of June. What is their plan B? What happens if in the middle of the registration we have to abandon it as a result of the pandemic or any other reasons? What happens to our entire process towards December 7th elections? They should tell us their plan B. Would they go back to use the old register if we are not able to continue this registration? Because anything can happen. There are a lot of scenarios, either the pandemic or any other reasons. We just want to know their plan B in case you are not able to continue. Thank you.
My name is Abdul Basit. Dear EC, I want to know why I cannot use my birth cert, which grants me citizenship by birth, to register in the upcoming new voter compilation. And secondly, passports here in Ghana is acquired by the highest bidder. That is why we have even foreigners pay huge sums of money to acquire it. Why do you trust something that anybody who can pay highest money to get, to use it to register instead of the current voter ID card?
So these ones are for Dr. Srebo Kweku, and he's on Zoom. Dr. Srebo.
Hello, Mefa.
Okay, so the questions are for you. It says, what is the plan B for the EC? Should we have to abandon along the line because of the pandemic, or if anything happens, touch wood, do you have a plan B?
Thank you very much once again. I pray that everything goes on. I don't wish that we'll go for any plan B. But I think we have laid down the plan B some time ago, that if it happens that we cannot do the mass registration, then the plan B will be to validate the current register and also go for new limited registration. And in each case, there will be this human contact. So the plan B will not remove the possibility of human contact. So I think these are the only possible way we can use the old register, but it will still be come back to the square one, where everybody will have to go to the polling station.
Okay, so the second question is passport is acquired by the highest bidder. Why do you trust it? He's asking why you cannot allow them to use their birth certificate, which grants them the rights of citizenship.
I don't have the evidence that the highest bidder gets passport, because I got my passport without paying. It was a normal procedure. You buy the form, you go through, and this time it has even been made simpler than used to be. I don't have any information that people have to pay higher money before they get a passport. I'm not aware of that.
So you don't know?
The issue about the Ghana card, our voter ID card, that's I've said that it's an issue that is being handled by the Supreme Court. And I've said that when the Supreme Court comes out with a verdict, the Commission is law-abiding and will go by it. If it is we should go do A or B, we will go by it. So that one, let's wait for. It's only 23rd. The judgment will come, or whatever the Supreme Court will decide, we will easily implement it.
Okay, so what you're saying is you've never heard that foreigners are holding Ghanaian passports?
So, for that, there are rumors. And it cut across all cards in Ghana. With the NIA card, we had it. Voter ID card, we had it. So birth certificate, we had it. So any form of card, we will hear people alleging that people have paid for it and foreigners are holding them. But I don't have the facts.
Okay. Well, let's go into the next batch of questions then. I have loads and loads of questions for the NIA and the Electoral Commission. So we're told that foreigners are also holding Ghana cards. And that is also something you dispute?
Foreigners can register for the Ghana card. We call it the FIMS program,
course, yeah.
where those cards are paid for. So it's not strange for a foreigner to hold a Ghana card, which is actually embossed on the face of the card, non-citizen.
Okay.
So foreigners also can possess the Ghana card, which is prescribed for them,
okay,
not the Ghanaian Ghana card.
Of course. Okay, so our next batch of questions are text questions, I'm told. Let's go through them. So this one from Facebook, Abraham Kujo says, good evening and thanks for having your guest. Please, may I know if there is going to be a stimulus package or probably an insurance package for the temporary staff the EC is engaging in this mass registration should anyone contract the virus? And this one is also for Dr. Sreboy. Says we should ask whether the temporary staff of the EC will be provided PPEs, including nose masks for their training. That is the registration officers, etc. Timothy is also asking. Stay on Facebook. Abdullah Osman says, will the NIA allow their staffs to go and register for the voter ID card since they are starting on the 18th of this month? Because both exercises, I guess, will be ongoing concurrently. And then a WhatsApp question. Mamisi says, government has given frontline workers incentives. Now that you are sending other people's children to the front line to undertake this exercise that many people have kicked against, what is their incentive? Okay, so these are the questions and the cuts across for both the NIA and then, of course, the EC. So since we are on the EC, let's wrap up on the EC. So they're asking that those you are sending out, do you have an insurance package for them? And should they contract the virus? And then as well as PPEs and then incentives. What's the situation?
Insurance one. I think last Wednesday or so, a renowned insurance company came to the office with a proposal. It is something that we are studying, that if it's possible that we can implement, the commission will implement that. Now, with respect to the PPE...
Maybe you can give us a bit of details on what the package includes, for instance.
Like the proposal they have brought.
Okay.
So the commission is studying it. And once they are studying it, it has not been concluded. So you cannot put in... because it's possible that maybe somebody can come out with a better package than the rest. So I know there's a proposal and it came through me, so I saw it myself. Then with respect to PPEs and nose masks and the rest, if anybody goes to the training centers, they will read that we have them, we have provided them with nose masks. We have Veronica buckets, sanitizers and the rest. So they are there. Everything that we intend implementing for the registration is being tried at the training. And I want everybody to understand that Electoral Commission is not insensitive. We know the challenges that we are in, but like I said, whatever be the case, we have to prepare and move forward with respect to the elections. So all the protocols and everything that we can put in place, we are doing so that it's a call to serve the nation. Ghana cannot do without a credible election and incontrovertible election. So we all have to contribute towards it. And with respect to somebody was saying, what are the incentives? I think the major incentive to the court to serve Mother Ghana, and there were some few other advances for them too.
It doesn't look like an attractive package at all, considering the season that we are in, because it appears that the EC has not even thought about it. It's not part of your plans. You've just received a proposal. The thing is happening on the 30th of June, and I'm sure you've recruited the people that you're going to be using, or you're saying that has not been done already.
Yeah, with respect to the insurance.
Yes, exactly.
Oh, like I said, it's a proposal that somebody has brought. So we need to study that. The work will start from the 30th of June. So, but before we will get to that stage, the commission will have taken the decision.
Yeah, because someone had to bring it. You did not think about it. And even that is still on the table. You are still considering.
You don't know the agreement we had, the consultation we did before the proposal was brought. So the proposal we are studying, and we'll see how best we can go with it.
Okay, well, we'll leave it there for now, but I'm sure there are more questions. And then this one is also for NIA staff, whether they will be allowed to go and register, because they are hoping that both exercises will happen concurrently.
Yes, we appreciate the fact that they have to register and get themselves on the electoral roll. We are in discussions with their leadership, and we still haven't finalized on how we would arrange that kind of allowance for them to go and register. But it's something that that has come up in our earlier discussion with the leadership, and we are yet to conclude on that matter. But it's something we are also contemplating. Do you have insurance packages for your staff, those who are in the front line, doing at least the issuance of cards, for instance? Should they contract the virus, what kind of package do you have for them? Is there anything in place at the NIA?
I know that also came up in their discussion with us. I do not have concrete information to pass on at this point in time, but I believe their welfare is also something we consider. They've been with us throughout the whole of last year until now, and so these are things that I believe once it has come up for discussion, is something we'll see through.
Well, that's responses to some of your questions that you've sent in. We're going to the next batch of questions at this point. We stay on WhatsApp, and this one says the EC official said on one platform that they were not going to allow more than 25 people at a center because of COVID. Political parties are allowed to send agents to the polling station to monitor. Cordeo and other election observers also send agents to monitor at the centers. Asking for me, how many political parties are in Ghana? And if all of them send agents to monitor at the center together with other observers, can he sincerely say that the objective of not more than 25 will be achieved? And this one also says, please, I have two questions. The first one is to the NIA. Why has no card been distributed so far in the Nchemboa district of the Eastern region? You go to the center and you are told it's not ready. Why are they not distributing the cards? What's the problem? And this one says, can the EC and NIA say emphatically that there are no individuals holding either the passport or NIA card who are not supposed to have it? If yes, then let's have a new one. If no, let's continue reviewing what we have. Nana Abdul Wadud sends that one. Okay, so there's one asking why you're not, distributing cards in Dencham or in the Eastern region, for instance.
Unfortunately, the lady or whoever sent the text did not tell us what explanation was given.
It says it's not ready.
I don't understand, because you see, at every center there's the album and we have cards to give out. So when you go to the center and your card is not ready, because we have about 14,000 cards in various stages of error, some are in adjudication and have not been printed, and so persons who fall in that category will surely not have their cards at the center. So if you go to the center and your card is not there, you may be in that category. All they will do is to take down your details and check whether your card is actually in that set of cards. So I have difficulty actually answering the question, because I do not know whether it's a case of the center not being operational. If the center is not being operational, the best person to explain to us is the district registration officer. Because when we go about registering, we sometimes do what we call the leapfrogging system. There are times when you have a lot of registration centers, you cannot operate all at the same time.
Okay.
So you concentrate on the densely populated areas first, and then you shift centers that are not in densely populated areas to other centers which are not densely populated. So if, let's say, we are here today, after a week we move to the next center. So it's possible that in the distribution of the card, they're using that same approach. So you have a case where maybe from tomorrow, they'll move into the area where she's talking about. So because I don't have the details, I'm unable to address or explain.
But you definitely check that, especially at that center.
I've written it down.
Well, for you, Dr. Srebo, the question, the first one is you may have said once that 25 persons will be admitted at each center during the registration. And he's asking, at the last count, how many political parties do we have? Because you have observers there as well. You have political party agents as well. At the end of it, it looks like the 25 persons will be made up of just the political parties and observers. What is left for us to go to the center to register? So at the last count, how many political parties do we have?
I think as of now we have about 20. Hardly was more than 3. So the parties are there, but not all of them send the agents. Normally you see 2, 3. I don't know what will happen this time around. But the most important thing is that we are going to mark the places for the applicants so that they will ensure physical and social distancing at the vacation centers. What we need to do is to ensure that the people are not crowded to facilitate the spread of the COVID. And as I said, we care about the lives of Ghanaians. They have to be alive before they even go and return and go to vote.
Unfortunately, I lost you on the last count of how many political parties we have and how many of your agents will be there. The line was cracking up a bit, so we didn't get that. Okay.
I said that, to the best of my knowledge, we have about 27 political parties now.
Okay.
But in most cases, exercises like this, you will see not more than 4. I have not come across a registration center with more than 4 agents before. So I believe it should be normal things that you got.
Not more than 4 for all the political parties, or not more than 4 for all the political parties?
You will not see more than 4 agents. I mean, I don't know whether you have been monitoring registration and the rest.
I'm asking for each political party because he says that you have mentioned that they will have their agents as well. So you said not more than 4. So we're just getting clarity whether the no more than 4 is for all the political parties you have on your books, or it's for all of them.
I'm saying that what I am going to say that political parties don't go beyond 4 when it comes to registration.
Okay.
So there are about 27 political parties, but you go to the centers and you don't see more than 4. That's what I mean. Okay. But the most important thing is that we are going to demarcate the registration centers to ensure the physical distancing. So no matter the number of people who will be there, the observers and the officials will have their area of operation. Then the political parties will have the applicants will also have the demarcated line where they will sit or stand, ensuring that we go by the social distance.
Okay, so you're not limiting it to just 25 persons. Has that changed, or is still the same?
It will depend on the size of the registration center. Okay. If the place is so vast that it can accommodate more than that, why not?
Okay.
But we would know the police stations, they were there, but we would demarcate the place that when you apply the washing of hand arrest, you have to enter a demarcated like what we normally do with the police stations during elections. And that is why we will ensure that the distances are there.
Okay. Let's get into the final batch of questions then, or you have a response to one of the questions.
Whether you have people who are not eligible, actually possessing either the
passport and then the NI card.
To the best of our knowledge, we haven't had a case like that. Now, even in our system, we noticed that those who registered in 2008, because that registration was across board, it included foreigners and Ghanaians. Now, some of the foreigners have come up through the vouching process as Ghanaians and provided information to that effect. But because the records of 2000 are already in our system, we see the anomaly, and those cards are held. It's not released because the system identifies an inconsistency in the fact that you are saying you are a Ghanaian, and in the previous one, maybe you were a foreigner of one of our neighboring countries. So it holds the card. Now, for those who have received the cards, until we investigate or establish that somebody is ineligible, for now, I'll say everybody who has a card is eligible. And until we establish that somebody has procured it falsely, we cannot do anything about it.
Okay. Well, we get into the final batch of questions at this point. We'll quickly go through them. So it's on WhatsApp. Esifwa Edward in Elmina says, Dr. Shrebo, the whole world is... Dr. Shrebo, I'll start with you. The issues about PPEs shortages across the country, and that why wouldn't we channel it to hospitals and all. But I would first want to find out about the procurement processes. We told us earlier that there was a process, and we even saw the advert also in the papers for the procurement of PPEs for the registration. Where are we with that?
The procurement activities are done in phases. We have procured those that are being used for the training. So if you go to any training center, all the PPEs are there. Then the one for the military too, I believe, have also been done, and as of now, I believe they should start being delivered. So all the PPEs are there. We have filmed the procurement documentations and the processes, so they are being done. There was a question which I think there was another side that they didn't answer. Somebody was asking whether we are not sure that people have the passport and the NA card who are not Ghanaians. What I want to put across is that presenting the passport and NA card alone doesn't mean that you are a Ghanaian. Somebody who knows you very well can still challenge your registration if the person knows that you have the card or the passport but you are not a Ghanaian. So that doesn't necessarily mean that once you have the document, then everything is complete. No, you can still be challenged if there's evidence that you are not a Ghanaian. With respect to the PPEs for the hospitals and the rest, I believe that election is also important, and the hospital is also important. We are getting our various individual budgets, and what we have acquired, we want to do our registration, and we are getting our PPEs for the registration. The hospitals too will be given their own consignment, which I cannot speak for the hospitals.
So they're asking whether you would not want to channel yours to the hospital. So that's what the question I was actually asking.
That's why I said we have our budget, they also have their budget. Okay. So we cannot go and provide them our logistics. But I don't know what they have also acquired for, and they are also getting a surprise. I believe they have also budgeted for, and they will be given their own form of PPs.
Okay. Well, so there's one also for you, Mr. Pamdeti, yes, on the verification
I think that has been answered.
Okay, yeah. And then also the charge.
The issue about whether one will be charged after the mass registration exercise. Now, after the mass registration exercise, we would, like I said, set up offices in the districts. Now, any applicant who is registering for the first time or first issuance is free. So you're not going to pay anything for it. It's only when you lose your card or the 10 years has expired and you want to get a new card that you pay for it. But for this first issuance, it's free for everybody. Now, he also asked about if you lose your card or it's defaced. Yeah. Of course, you have to replace it. Now, any time you're replacing a card, you have to pay for the card. And I think it's 30 Ghana cedis for replacement. So you have to go through the process of reporting the loss of the card to the police. They'll give you an extract. You attach your request for a replacement. You attach the extract to the request for a replacement. You submit it at the nearest NI office, make the payment, and then the card will be replaced.
Okay. Well, so we should be wrapping up at this point, but one question that keeps on popping up via WhatsApp, Facebook, Twitter, and everywhere. Dr. Srebo, you are the Director of Electoral Services. They keep asking this question. You've also talked about the Plan B, for instance, if we have to abandon along the line. So the question then is, that in your heart of hearts, they would want you to tell Ghanaians that as Director of Electoral Services, in your heart of hearts, do you think that the times that we're in, knowing the COVID situation and all, do you think, they've said that because we've used it for the creation of the regions, we've used it for the district assembly elections and all, in your heart of hearts as a Director of Electoral Services, do you think that we need a new voters register, and why?
What I would say is that if you want to have incontrovertible election 2020, then the foundation is a credible register. And I believe we can have more credible register for the election. So at any point in time, I will go for the new register. Okay.
Well, so in wrapping up, we'll just go quickly to Facebook Live, the comments that have come in. Bitika says, if people can go to the market daily and go about their normal activities, then the EC and NIA can do the registration whilst observing COVID-19 protocols. Richard Kwabneji says, my concern is we are not in normal times. Even when people are not lining up to register for any ID card, we are having an average of 250 infections per day. There is a cause to worry as a country. If you're ready to register because you are a party foot soldier or whatever, just remember you're not immune against COVID-19. Now, Listowell Tre Skilo says, we are not safe at all as Ghanaians, but can't we postpone this new register? That's Listowell's comment. And okay, so Jake Koba is also talking about why the exclusion of the existing voters ID card. Dr. Srebo has spoken about that. And Nana Nie says they should hurry and start with it. Even best countries in the world are out in their numbers protesting. How much more registrations? A small country of Ghana, we don't have one card that will be used for everything, and we sit down complain that we want to move forward. and my time is actually up. So that's it for some of your comments, live comments, watching on Facebook, and these are the comments. I've given the final word to Dr. Srebo, so I'll give you also the final word. One, why don't we have one card for everything as a country?
I think we are moving in that direction. Our card fortunately has what we call 14 applets, and these applets can take on information from other agencies or other cards. As I speak, NHI has decided to stop issuing its cards and would want to piggyback on our card. So they'll use an applet. Senate is also intending to do the same. So we think there's still enough room on the card to take additional information from other organizations. So eventually, it's possible we can have one card that would serve all other purposes. But as we stand now, I think we'll urge all those who have registered and haven't received their cards to go to our centers to go and pick their cards, and also those who have been registered to get ready for the mop-up exercise.
Okay. Well, Dr. Srebo, we are looking forward to June 23. Are you hopeful?
June 23.
You're going to
That's our expectations. So let's wait and listen to what the court says. But as I said, whatever the court decide, Electoral Commission is a law-abiding institution. We'll go by it.
Okay. Well, that's it. Dr. Srebo Kweku is the Director of Electoral Services at the Electoral Commission. We're indeed grateful for your time here on Beyond the Lockdown. And of course, Assistant Commissioner of Immigration, Mr. Palmdetti, is Head of Corporate Affairs at the National Identification Authority, was also our guest here on Beyond the Lockdown. Remember that the President just updated us in terms of our cases. It's 11,964. Our active cases are 7,652. Our recoveries, however, are 4,258, and our